I want you to tell me about your big news, and share with me about the Saint Protocol.
Sure. Well, the big news there is that we are now approved to administer the real Saint Protocol.
Mm.
There are lots of people who have been talking about Saint now for a number of years, but the components of Saint are that the number of pulses is triple in each session what it had been in what was called the 3D study, one of the earlier theta burst studies. So it's a more intensive dosing. It's 10 treatments per day with a very close monitoring of the time locking of when did the treatment start. It's 50 treatments altogether, so 10 a day for 5 days.
Okay.
And it uses a very special neuronavigation approach where there are algorithms that the folks at Stanford, Nolan Williams in particular, was involved in developing. And now that intellectual property, those patents have been licensed to a company called Magnus Medical in Northern California. And they are now in the process of making it available to clinics such as ours under limited circumstances. But now we are now the only program in Los Angeles County that is authorized to offer the real, genuine, honest to goodness Saint Protocol.
That's wonderful.
And so far we've found it to be very exciting, both for the patients and for all the staff to be able to offer this, because this is the protocol that has led to these really remarkable kinds of outcomes. Where 80% or so of people will get a meaningful response, and 75% of people will get into remission. Compared to more like 25-30% of people who remit with the more classic kinds of TMS.
Well, and when I think about this, right, you look at times today, instant gratification, social media, and all these things. Anybody is going to want to do this in a week rather than 6 to 8 weeks, right? That's far less of a commitment. I'll give you 1 week, and I'm going to know in a week if I'm going to be better or not. Versus, I got to wait 8 weeks to tell if I'm better. Well, hold on, right? Talk to me about that.
Well, sure. Well, I think it's important to recognize here that Nolan Williams and the group were focused initially on having a protocol that could be done on inpatients. For most kinds of medicine, most parts of medicine, when you move from the outpatient setting to the inpatient setting, you have more treatment options. There are medications that can be given safely in the hospital that are hard to give on outpatients. There are lots of things, other parts of medicine where as you go into the more intensive settings, you get more options. It's been the exact opposite in psychiatry, where if you start a medication, a regular oral medication for a patient, you're going to have to wait weeks before you see is it helping.
That's true.
And so it's not like that for inpatient psychiatric care. ECT is probably the one exception where you can start that as an inpatient, but you can start that as an outpatient too. So there's not that kind of thing. So part of the vision there, and I hope I'm not speaking out of school about this, but part of the vision was to have something that could be useful for inpatients, and that's in part why the idea of 5 days, 10 a day, with people who are there in the hospital and can come to the treatment rooms that many times in a day. Now we're working with outpatients, and that's terrifically exciting because, as you said, coming in every day for 6 to 8 weeks versus coming in long days, but for 5 days in a row.
Well, talk to me about the long day real fast. So sure. What time is the patient starting in the morning? What time are they finishing at night?
Sure. So typically they're starting at about 7:30 in the morning, and are done somewhere around 5:30 at night. So it is a long day, but in each of those 10 treatments they're getting, the treatment lasts about 9.5 minutes. We allow a few more minutes to get people situated into the chair, get everything lined up. And And then the rest of the hour until the next treatment. So if you get one at 7 o'clock, or sorry, if you get one at 8 o'clock, your next one's at 9, your next one's at 10, and so on.
So it's about a 45-minute interval in
Yeah.
between.
During which time people can do kind of whatever they want. We have high-speed Wi-Fi here. Most programs do. So people can be online. They can be responding to emails if they have work to deal with. They can be watching, YouTube videos for their amusement if they want to. We have people who watch, streaming movies and other kinds of programming. People who like to read these old-fashioned things called books on paper. And sometimes people just like to listen to music and relax. We've had more than one person who's like to do yoga in between sessions. So
very healthy.
Trying to get some synergy there.
I like that.
So it's with the Saint protocol, there is, because of the neuronavigation part, there's a device called a tracker, which we attach to the forehead with some adhesive tape. And so we ask that they not bump that, because then we have to recalibrate it if it's bumped out of alignment. But aside from that, people are pretty much able to do what they wish.
And
even go and walk around the block if they want to.
So they come in the morning, 7, right? They're done by 5, 6 o'clock. Are they driving home? Are they comfortable? Right? So
our experience, and this matches with what other people have reported to, is that people generally feel kind of tired.
Of course.
And what is it that fuels that? Is it all the extra stimulation? Is it the cabin fever of having been in a clinic
all day,
for all day long?
Yeah.
It's hard to know, but regardless of the cause, it's a well-reported phenomenon. And so we caution people that, if they have a long drive, they may well want to, either, get an Airbnb that's nearby, or have someone come and get them. But they're cognitively intact. It's not like with ketamine where you're going to be loopy for a while.
Got you.
It's people are cognitively as sharp as ever. They're just kind of tired.
I mean, the way I would look at it is to be, spending 8 to 9 hours in the gym all day, right?
Yeah.
You're going to be tired after.
You're going to be tired.
Yeah, it makes total sense.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.